Let's discuss the attachments of the humerus. To understand these better, you must watch my previous video in which I told about the anatomical position and the features of the humerus bone. So let's begin with the attachments. On the lesser tubercle, there's the insertion of the subscapularis muscle. On the greater tubercle, we have the attachment of the musculotendinous cuff, also known as the rotator cuff, which includes muscles beginning with the supraspinatus, infraspinatus, and the teres major. The supraspinatus attaches on the uppermost impression of the greater tubercle. On the middle impression, we have the attachment of the infraspinatus, and on the lower impression, we have the attachment of the teres minor muscle. Moving on to the attachments of the bicipital groove. Like in my previous video, I told you about the bicipital groove having a medial lip and a lateral lip and a floor. So on the medial lip, there is the insertion of the teres major muscle, and on the lateral lip, we have the insertion of the pectoralis major muscle. And on the floor, we have the insertion of the latissimus dorsi muscle. In order to remember this, there's a funny mnemonic, a lady between two majors. So on the sides, we have the major muscles, and in between, we have the latissimus dorsi. So now for the contents of the bicipital groove. Through the bicipital groove, we have the long head of bicep brachii muscle passing along with its synovial sheath, and there is the ascending branch of the anterior circumflex humeral artery. On the anterolateral surface, we have the deltoid tuberosity, where the deltoid muscle attaches. It is a V-shaped tuberosity. On the medial border of the shaft, we have a roughened area in the middle of the medial border, where the coracobrachialis muscle attaches. The brachialis muscle arises from the lower half of the anteromedial and the anterolateral surface. The brachioradialis muscle arises from the upper 2/3 of the lateral supracondylar ridge. The extensor carpi radialis longus muscle arises from the lower 1/3 part of the supracondylar ridge. Then the humeral head of the pronator teres muscle arises from the lower 1/3 of the medial supracondylar ridge. Then the superficial flexor muscles of the forearm arise from the anterior aspect of the medial epicondyle. The superficial extensor muscles of the forearm also have a common origin from the lateral epicondyle, along with the supinator muscle. The anconeus muscle arises from the posterior aspect or the posterior surface of the lateral epicondyle. So now about the triceps muscle. The lateral head of the triceps muscle arises from the oblique ridge present above the radial groove, which is on the posterior surface. The medial head of the tricep arises from the posterior surface beneath the radial groove. Moving on to the attachments of the ligaments. The capsular ligament of the shoulder joint attaches to the anatomical neck of the humerus. It dips down 2 centimeters and includes a small area of the shaft within the joint cavity. This 2 centimeter dip down occurs at the medial side. There is a small aperture within this ligament at the site of the intertubercular sulcus, and this is because the tendon of the long head of the bicep brachii passes through this capsular ligament. After discussing the capsular ligament of the shoulder joint, let's move on to the capsular ligament of the elbow joint. Unlike the capsular ligament of the shoulder joint, which was attached on the upper end of the humerus, the capsular ligament of the elbow joint attaches on the lower end of the humerus. So on the lower end, the ligament attaches above the limits of the radial and the coronoid fossa. So this is the radial fossa and this is the coronoid fossa. The capsule attaches right above them. This was about the anterior aspect, and on the posterior aspect, the capsular ligament attaches right above the olecranon fossa. So this way, all these three fossas, they lie within the joint cavity. So medially, the line of attachment passes between the trochlea and the medial epicondyle. So this is the line of attachment between them. And on the lateral side, the line of attachment is between the lateral epicondyle and the capitulum. So right here.